Ever found yourself zoning out for a few seconds and wondered if you missed something important? For people with petit seizures, also known as absence seizures, are not just a daydream, it's a medical event. My name is Blake Grothaus, and petit are just one of the type of seizures I have. Let's talk about what petit seizures are, what causes them, and how they shape the lives of those who experience them. So, what exactly is a petit seizure? It's a type of epilepsy where the person suddenly stops what they're doing, stares blankly, and may even flutter their eyelids or make small movements. These episodes usually last only a few seconds, but they can happen many times a day. And here's the kicker, most people don't even realize they're having one until someone else points it out. During a petit seizure, the brain has a sudden burst of abnormal electrical activity. There's no dramatic collapsing or convulsing, just a sudden pause in whatever the person was doing. Imagine you're mid-sentence, and then, just like hitting the pause button, your brain checks out for a moment. When it's over, you pick up right where you left off, often with no memory of the gap. So, what causes these seizures? They're most common in kids between ages 4 and 14, though adults can have them too. Genetics play a big role, meaning if there's epilepsy in the family, the risk goes up. Sometimes triggers like flashing lights or hyperventilation can bring one on, but often they just happen out of the blue. Symptoms are pretty subtle: blank staring, rapid blinking, maybe a slight twitch of the mouth or hands. Friends or teachers might notice a child seems to space out or not respond for a few seconds. That's usually the only clue. As for treatment, most people respond well to medications called anti-epileptic drugs. The goal is to reduce or stop the seizures altogether. It usually takes a bit of trial and error to find the right medication and dose, but the success rate is high. With the right treatment, many kids outgrow petit seizures by their teens. But living with petit seizures isn't just about the medical details. It can be tough, missing out on moments in school or feeling anxious about spacing out in public. Support from family, friends, and teachers makes a huge difference. It's all about understanding, patience, and a little bit of compassion. So, if you know someone with petit seizures, remember a few seconds can mean a lot. A little awareness goes a long way in making life easier for them. And if you're living with it yourself, know that you're not alone, and there's help out there. Subscribe to help support.